50.31% men under the age of 30 have started facing hair loss.
If you think your hair growth has stopped, you think you are losing hair much faster than you are growing hair.
Hair fall oils आते हैं, hair fall shampoos आते हैं, अब hair growth pills आने लग गई है, hair gummies आने लग गई है, ये सब काम करती.
The products you are using are not as effective as they should be in growing your hair properly. And this leads to your thinking that something is internally wrong with my hair cycle. That is why my hair is not growing properly as effectively as they should grow. Now, what do you think is the reason? Do write in the comment section below. Studies suggest that disruption in the hair cycle can lead to hair shedding and improper growth of hair, as you can see in the article on your screen. By the end of this video, you will understand what is the hair cycle and how it relates to your hair growth problem, and one mistake that slows hair growth and how to fix it logically, not randomly. Let us take a scenario. There is a person who is noticing a change in his hair. The hair is growing thinner and getting sparser. So he thinks, let me buy some good oil serum or shampoo. And he buys the products. He starts using the product and he uses it very nicely for 3 months. But he sees a minimum change in the problem he is facing. So he abandons the product and he is now in a panic that time is lost. The hair did not improve. What to do now? Now the problem was not with the product, it was with the problem he was facing. The root cause, the reason why he is facing hair loss did not appropriately align to the products he bought. So let us today understand the disruptions in hair cycle and what these disruptions are and what are the features which will tell you what is wrong and then how to treat them. So disruption number 1, that is the anagen or growth phase of the cycle is disrupted. It is lessened in time and the hair which grows in the next cycle is weaker or thinner than the previous one. This is very typically the male pattern baldness or the androgenetic alopecia. The miniaturization happens, anagen gets shortened, and this way you start having a baldness on your head. This is type 1. Type 2 can be when you face some problem either externally like the mental stress or internally that you fell ill, there was a surgery, there was a baby delivery in cases of females, or so many other internal metabolic factors which lead to telogen effluvium acute type. So that particularly happens between 2 to 6 months of the problematic event, and then because of this disruption you lost your hair, a lot of hair shedding was there, very heavy shedding, but then you gained your hair back. Type 3 would be when you lost your hair by this acute telogen effluvium method, but the problem persisted though in less amount, and that led to chronic telogen effluvium, and so when you got the hair back they were not of the same thickness or same length as they were before. So a weak type of previous shaft is now there on your head, so you are having less hair than before. This is type 3. These are the commonest types of problems which are faced, and for type 1 it is mainly minoxidil which helps. For type 2 and type 3 we'll be discussing in a very short while. Hi, my name is Dr. Preeti Saraswat. I'm an American board certified hair transplant surgeon working at Saraswat Hospital Agra, seeing a lot of hair loss patients and people who want a hair transplant for past more than a decade, helping more than 1,000 patients in their journey towards hair restoration. We are making the educational series for you to understand how and why you are losing hair and how you can go about it. You can see a hair growth cycle on your screen now. The most desired hair in the hair growth cycle is the anagen phase hair. This growing phase hair we all want because it keeps on growing on the scalp for around 2 to 6 years. Next, when the hair is about to shed off, it undergoes catagen phase, which is in weeks, then telogen phase, which is in months, and then exogen phase, like the hair shaft is shed off and a new baby hair starts coming out from the same follicle. A healthy follicle completes 25 to 30 cycles of this hair cycle before it permanently retires. Every cycle you spend in inflammatory cycle or unhealthy milieu or poor nutrition for the hair to grow, the hair stops coming back in the next cycle. That is why it is very important to have healthy hair on your scalp rather than counting the number of hairs only. So the quality of hair matters a lot, though the quantity also matters. Now you can tell me in the comment section below how many products you are using at present for your hair. Let us identify the disruption. आपका hair अपनी growth cycle में कहाँ गड़बड़ हो गया without spending a penny. So type 1 disruption, as I told you before, आपका hair धीरे धीरे पतला होता जाएगा, miniaturized होता जाएगा, and then gradually it will stop coming out. This is what happens when you are having a androgenetic alopecia problem, which is male pattern baldness, or in females female pattern baldness. In this type of problem, there are very specific medications which will help you. Type 2 I told you is that which is acute telogen effluvium. कोई एक problematic event हुआ जिसके बाद shaft बहुत सारे shed off हो गए, and then this happened between 2 to 6 months of that problematic event, but that event completely weaned off. Then you started having good hair again. Please understand very clearly, अगर आप treatment नहीं भी लेंगे, you will gain all your hair back because that problematic event is over. Now type 3 disruption I told you was कि disruption हुआ but धीरे धीरे वो चल भी रहा है, and so the hair you are gaining back are not those good sturdy hair which you used to have. In this kind, probably the problem which is persisting may require different multivitamins, your hormonal assessments, different other types of medications, so you need to see a doctor. When you will see your doctor, you will definitely be given a few blood tests so that we understand what is going on with you. That blood test may include serum ferritin along with hemoglobin, different hormonal assessments like thyroid, and different other assessments like vitamin D3, vitamin B12, serum calcium, zinc, and so on. Now let us match the intervention with the disruption type. अगर type 1 problem है आपको shortened enagen, then we would be requiring the DHT blockers along with medications like minoxidil, and the health supplements, nutritional supplements may help definitely. So the doctor would prescribe you accordingly. In type 2, अगर आप कुछ भी नहीं लेते तो भी आपको hair वापस मिलेंगे because वो acute telogen effluvium था, but supportive medication helps in bringing the hair back early. So sometimes we prescribe minoxidil to you and nutritional supplements as well, along with some serums if required like Redensil, Procapil, and so on. In type 3, we assess what is wrong, how many things are wrong, and we try to help you accordingly. हो सकता है आपको hormonal treatment मिले या multivitamins मिले, serums मिले, so that is up to the doctor to give you the required medication. So doctor's consultation is a must regardless of any problem you are having in the hair cycle disruption. So if you have lost a lot of hair and you want a hair transplant to be done on your scalp, you can call us or WhatsApp us your pictures on the numbers below. Now what your progress would look like when you have started medication with your doctor. In type 1 disruption, that is you are having androgenetic alopecia, the first thing to be achieved by medication is less hair fall. So decreased hair fall is number 1 in first 3 months. Then for the next 3 months, there should be stabilization. For the next 3 months, there should be regrowth, and then for the next 3 months, sturdiness in the hair which you are having. In type 2 disruption, where there is acute telogen effluvium, you will see that the areas where you had lost hair will start showing little baby hairs, and then they will grow nicely as you had hair before. In type 3, you will start having hair growth from all over the scalp where you were losing hair, and again baby hair will grow into better hair, and with the medication you are having, the quality of hair will improve. When to reassess? अगर आपने medication start कर दिया अपने डॉक्टर के साथ और आपको लगता है कि hair shedding decrease नहीं हुआ, 3 to 4 months 6 months पास हो गए but scalp show बढ़ गया, या फिर कोई itching बढ़ गई, flakiness बढ़ गया, any sign of inflammation which was not there before has come up, या कोई और दिक्कत आपको लगती है कि ये हो रहा है, please see your doctor again, because then maybe we need to re-identify the problems, diagnosis revisit करके maybe we reassess and give you a proper another line of management. Do share this video with your friends and family who need this info. If you want to know how this patient gained his hair back after hair transplant, please click the link on the left. And if you want to know why we lose hair while combing or washing, please click the link on the right.